Alright, so first we have the mirror, which is used to look at the tooth. Then next we have the explorer, which is used to ensure proper placement of the matrix band. And then here we have the perio probe. And then we have the spoon used to remove carious dentin. Now we have the enamel hatch used to smooth walls and cavity preparation. And then we have the mesial gingival margin trimmer used to create bevels on mesial margin during prep. And then the same follows for the distal gingival margin trimmer. And then we have cotton pliers used to remove the place wedge, matrix, and retainer. Then we have the acorn burnisher to smooth amalgam after condensing. And then we have the ball burnisher used to contour the matrix band and shape the amalgam. And then next we have the discoid clear carver, which is used to carve anatomy. And then same goes for the half holland back carver. This is also used to carve anatomy. And then next we have the articulating paper holder. We would also have paper that goes along with this. This is just used to check occlusion. Okay, so for this next one is the liner applicator, but I also grabbed the condenser, I think. So the one on the left is the liner applicator, and that's used to place dental liner into the cavity prep. And then the instrument on the right, and then this next one that I'm about to grab is the large and small condenser. These condense the amalgam material into the prep tooth. And then I'm going to grab the Toffelmeyer to hold and maintain stability of the matrix band, and then the matrix band is used for placement of missing proximal wall or walls of cavity prep. And then next I've got the crown and bridge scissors. Next I'm going to grab the anesthetic aspirating syringe and needle. This is used to inject anesthetic into the patient. And then I also would have the anesthetic carpules, which contains the anesthetic. Now I've got the cotton tip applicator. This is used to place the topical in correct area. And I also would have the topical material. Cotton rolls and 2x2 gauze are used to dry the tooth and used for isolation. Now the amalgam well, this is used to hold the amalgam before it is placed into the prep and to hold while loading into the carrier. I've got the amalgam carrier. This is used to transport amalgam from well to the tooth. Now I've got the spatula and the mixing pad to mix the DiCal material. So next I'm going to grab the amalgam capsules. These contain the amalgam material. And now I've got a little yellow wedge to hold the matrix band in place. And floss to check the interproximal contacts between the teeth. Alright, so now I've got the high and low speed hand pieces, and I'm missing one of the pieces for the low speed. These are used to prep the tooth for the amalgam. So next I've got the air water syringe. This is just used to rinse the patient's mouth and keep everything clean. And now I've got the saliva ejector and the HVE, and these are just both used to maintain the operating field, keep everything nice and clean.